Hey everyone, I'm Dr. Tudan Kathy Nguyen. I am a primary care sports medicine physician with Memorial Hermann at Physicians at Sugar Creek. I am the sports medicine director for the Memorial Family Medicine Residency Program and also the team physician for the Houston Dash, University of Houston, and Houston Baptist University. I'm super excited to be here for Game Ready Part 2 to talk to you all about updates with our COVID-19 return to play guidelines, along with discussion on how to return back to athletics and being active if you've had previous COVID-19 infection. So where are we at now with COVID-19? So looking back to whenever the infection just first started, January 21st of 2020 was when the first infection was reported. At that time, we did not know much about the virus. We were scrambling to figure out what to do, and over a year later, we have a vaccine, we have protocols, we have all these measures now. So look at January 2021, 1 year after the first case was reported. We were having about 250,000 new cases reported of COVID-19 a day. And we've really seen a decline since vaccinations have started. Right now, in June, July of 2021, we're seeing about 12,000 new cases reported a day. That is a major difference, and I'm very happy to see this, and hopefully going forward we continue to keep the numbers low so that we can get back to our daily normal regular activity. So remember back 2020 in the spring, things were shutting down. Sports in 2020 was very different. We had shutdowns for professional, high school, college level. Remember whenever NBA had their first case back in March, they completely shut down. New protocols were starting. The National Women's Soccer League was the first actual league to have a successful bubble game series, and the Houston Dash did win that championship, which is great. And then also back in that time frame, we were trying to figure out what the testing cadence should be. So some teams were doing daily testing, some organization and leagues were doing every other day, and then colleges were doing 3 times a week. Now we're past that point, and we're really modifying our protocols to have a safe play environment for our athletes. So at this time, whenever an athlete is fully vaccinated, we're really adjusting that testing cadence so we don't have to test once a week or twice a week anymore, which is great. So what's next? We currently have vaccinations, which is very exciting news. But there's also some new data for people with persistent symptoms after having a COVID-19 infection. Also, there are updated return to play guidelines for someone who has had the infection. And then lastly, how do we continue to stay safe, and how do you continue to allow participation in athletics going forward? So with the vaccination, we have 3 types, Pfizer, Moderna, and the Johnson & Johnson. The Pfizer and the Moderna vaccinations are the mRNA types that are 2-shot series. We've seen them reported ever since January, February timeframe of 2021, and now they're readily available. Johnson & Johnson kind of came up afterwards, and it's an easier vaccine because it's only a 1-shot series. Remember, it takes about 2 weeks at least for you to be considered fully vaccinated after completing the series of one of those vaccinations. It's really exciting to see that now in July of 2021, we have these vaccines available. If you were to ask a lot of physicians back a year ago, we were thinking, no way, we wouldn't have been able to have all these advancements by now. But looking at the nation, about 50% of the nation is vaccinated, and so they are readily available. Ask your local healthcare provider, ask your team physicians, ask your athletic trainers with your teams how you can get access to these vaccines. I think this is a really important step in getting our athletes back to a safe playing space whenever we reach that herd immunity with most of the teammates and the staff being vaccinated. So What is the advantage of being fully vaccinated? The CDC has an updated guideline for people who are considered fully vaccinated. Really big thing is you can resume those regular activities without wearing a mask or staying 6 feet away from people, as long as you're following the guidelines of your institution, the federal, state institution guidelines, and also your workplace guideline. Also, there's adjustments to travel. You don't have to do the quarantine anymore if you've been fully vaccinated, depending on the country that you're going to, and then that also applies domestically too. And if you have been around somebody positive for COVID-19 and you are considered fully vaccinated, you do not have to quarantine anymore. And that is really important to note too, unless you have any symptoms of COVID-19. If you do have symptoms and you've been exposed, you still have to follow the quarantine protocols. The CDC does recommend that people with vaccination still be safe around people who are unvaccinated, and then people who are unvaccinated still need to wear a mask and follow all those measures that we talked about last year. And make sure you still watch out for those symptoms of COVID-19. And the reason why is there are new variants of the virus. The Delta variant is one that has been spiking in multiple areas of the world and also in the United States. What we know is the vaccine does serve some protection as far as the severity of the infection with some of these variants, but we don't have the long-term data to know for sure if you're fully protected and which specific variants that they will cover. So more to come with that. Continue to follow the updates from CDC, World Health Organization, and your local healthcare provider. So post-COVID-19 infection symptoms can be a constellation of multiple things. Somebody who has had COVID-19 may not have any symptoms whatsoever, so they are asymptomatic, but then there are the ones with the mild symptoms completely resolved, but then suddenly weeks or months later have these generalized constellation of odd symptoms which may be related to having the infection. We call those people long haulers, or basically PASC, post-acute sequelae of SARS-CoV-2 infection symptom, and they can include fatigue, shortness of breath, difficulty with exertion, so not being able to exert the way you used to in the past. May have some brain fog, sleep disorders, so difficulty falling asleep or staying asleep, generalized gastrointestinal symptoms like diarrhea, constipation, nausea, feeling uneasy in your stomach, and then also some mental health implications like anxiety and depression. So these symptoms can persist for months. They can be pretty debilitating, or they can just be mild and it seems like you can get over it, but you're just not 100% yourself. So if you are in that category, make sure you seek care with your healthcare provider. The goal is to be able to figure out how we can help these patients in a multidisciplinary setting with a physician, a therapist, and also maybe some mental health coaches down the line. The National Institute of Health is working on more research in this subset of people who have developed these symptoms also. Going forward, we want to really recognize that physical activity has been an important factor for our athletes, for our general weekend warriors, for everybody in the population. And there have been studies now to show that the past year of social isolation, at home teaching, and then just kind of sitting at home all day has been really difficult for people as far as their health, increasing a rise in chronic health conditions along with the mental health diseases like anxiety and depression. So it's really important that we're starting to engage back in athletics and sports because it has both physical and psychological health benefits for our children and our adolescents along with our adults. We know that physical activity increases the cardiovascular health, strength, and body composition, and just overall fitness of a person. And then that socialization with friends, coaches, and the community allows for better mental health and also a more structured routine for someone, especially with our young athletes. That structure is important for day-to-day living and their mental health. For our young athletes also, physical activity promotes their developmental growth, and in general, exercise benefits the immune system. So getting back to safe physical activity is key. The American Academy of Pediatrics strongly recommends that opportunities for children and adolescents to participate in sports and physical fitness activities resume as soon as SARS-CoV-2 transmission mitigation strategies are in place and local authorities approve. So we're really at that stage now. We're at the stage where we can start resuming physical activity and also promote safe physical activity in sports in our communities. So now that everything is opening up and schools will be opening at full capacity in the fall, athletics will be starting again, and then your athlete might be participating in league sports, make sure you do get their pre-participation physical completed this year. So I always recommend doing this at least 6 weeks before the season starts. And why is that? It's because if there is an abnormal finding on either the screening questionnaire or with the exam, then you have that time to get the athlete screened completely for whatever they need to get after the initial exam. So with our pre-participation screening, we evaluate head to toe, all the organ systems, listen to the athlete's heart, listen to their lungs, evaluate the red flag symptoms, you would say, in the questionnaire, and make sure you do mention a history of having COVID-19 so that we can either encourage doing an electrocardiogram evaluation, or if they do continue to have symptoms, we can help guide you to the next steps and who to see to care for your athlete before they can safely return to athletics. And so once an athlete has had COVID-19, we have new and improved data to say how we should counsel or advise the athlete to return to sports. The British Journal of Sports Medicine created an algorithm or a return to play protocol to help guide the physicians and clinicians to really say that this athlete can return back to full capacity without the implications and risks after having the COVID-19 infection. So going through this graduated return to play protocol, we're really utilizing this for athletes who have had either mild to moderate symptoms. If they have had severe COVID-19 symptoms, we somewhat follow this return to play protocol with some other modifications and testing and specialty involvement too, as far as seeing a cardiologist or maybe a pulmonologist. So for example, with this return to play protocol, we may have an athlete who had mild symptoms of COVID-19 for approximately 2 to 3 days. So the recommendation is allowing some time for rest and some time for recovery before starting any physical activity. So essentially saying about 10 days from symptom onset and at least 7 days of being symptom-free, the athlete or the person can start a graduated exercise activity level. So the stage 1, which is an approximate 2-day protocol stage, they can engage in about 15 minutes or less of physical activity that includes light walking, and then intensity of no greater than 70% of their maximum heart rate. There's also no resistance training, no high interval intensity training in this first stage of the initial 2 days. After those first 2 days, if the athlete feels good, have no return of COVID-19 symptoms, or essentially feeling their normal 100% self, they can proceed to stage 2, which is a 1-day minimum where their time for activity can increase to about 30 minutes, and they can add in some simple movement activities like running drills, increase jogging intensity, and then can go up to about 80% of their maximum heart rate. Completing stage 2, they can move on to stage 3, which is about a 1-day evaluation that they can participate in about 45 minutes of physical activity. They can progress to more complex training, intensity still no greater than 80% of maximum heart rate, and can add in light resistance training at that point. Passing stage 3, they can move on to stage 4, which is about a 2-day stage where there is 60 minutes of physical activity. They can be back to normal training at an intensity no greater than 80% of the maximum heart rate. So within those 2 days for stage 4, they are essentially doing what they normally would do in athletics, but after they complete those full 2 days, you have to reassess. Do they have any new symptoms? Are they feeling more short of breath? Are they feeling pretty fatigued compared to how they used to before? If they have, we know we need to slow down and they're not ready to go back to full competition or activity. If they pass those 2 last days and they feel completely normal, back to themselves 100%, then they've essentially reached stage 5, where they can return to full activity and participation. And then they can try and continue that until stage 6, where they return to full competition and really compete with their teams. It's important to note that at this stage, we are still monitoring our patients and our athletes. If they feel like they've gone back to activity and it's been a 1 week from their clearance and now they have new symptoms, we aren't going to say, oh, you've passed protocol, this is something new. We still have to be very mindful that this could be a sequelae of their infection. So the Texas Medical Association did provide an algorithm for physicians to follow for our pediatric population, essentially helping us decide who needs advanced cardiac imaging or screening, who needs advanced testing, and who doesn't. Essentially, if an athlete had COVID-19 and they have been asymptomatic and it's been 14 days or more, they can be cleared for participation. If they've had moderate to severe symptoms, then you have to consider further testing. It's really that moderate group that is of question for us, because they're the ones that either have normal EKG and normal evaluation and can go back, or they have been evaluated with an EKG or an electrocardiogram and they have shown to have some abnormalities in that sense, then we do have to do further testing. We have to send them to the cardiologist, and then we have to risk stratify going forward to see if they're safe to return back. So this is a nice, easy algorithm for physicians going forward to really identify where their athlete falls into the spectrum. There are some advanced questions that should be asked before really deciding if an athlete or your patient needs to get further testing. So some of the questions involve if they've had chest pain or tightness in their chest with exercise, unexplained syncope or fainting, unexplained or excessive shortness of breath or dyspnea on exertion, unexplained or excessive fatigue with exertion, new palpitations or fast racing heartbeats, or a new murmur on exam. If someone says yes to these questions, then I would recommend further cardiac evaluation and more extensive testing. And the list below really shows all the other tests we might do. So the 12-lead ECG or EKG, an echocardiogram or the ultrasound of the heart, a cardiology evaluation with the specialist, possibly chest x-ray, spirometry to test for their lung function, maybe a chest CT or possibly a cardiac MRI, and then some blood work to really evaluate the heart and for inflammation of the heart. So I hope that the algorithm does help you as a parent or as a clinician decide where to go as far as decision making for return to play in athletics with your athlete, and also use that gradual return to play protocol to help slowly engage your athlete back to activity if they have had the COVID-19 infection. Moving forward, it is really important to still practice the best practices in the athletic setting and for your social setting too. Our athletes are very engaged in the social setting in their communities, and they also have exposures to multiple people, either in leagues, citywide organizations, other people out of state, and then also sometimes out of the country. So they do have increased exposure sometimes compared to the general population. So I still encourage the best safe practices. One thing is vaccination. Vaccination does help reduce the spread of the infection along with reducing the severe symptoms. So having the vaccination, although you may still catch the virus or a variant, will likely decrease the symptoms and the ongoing long hauler symptoms going forward. Make sure you're still considering bringing your own equipment to training, so your own water bottles, towels, and don't share soiled items or water bottles with teammates. Really important to stay at home still if you are sick, because not only are you possibly carrying a variant if you're vaccinated, you could have the infection if you're not vaccinated, or you might be carrying some other different virus or bacterial infection. Cover coughs and sneezes, and then sanitize your hands afterwards. So, we are all going to have a cough or a sneeze here and there. Just do it with your arm to cover, then wash your hands after. For the coaches out there, set expectations early for safety. You are basically the role model for your athletes. So if you have that safe expectation, really put down your best practices there, then your athlete will follow suit and really listen to your advice. Be mindful, like I said, other viruses and bacterial infections are there. So there's flu, there's strep, mononucleosis, rhinovirus, many others. And so, you can still have an outbreak of the flu. So all of these best practices will help you mitigate the infection for not only just COVID-19, but other viral and bacterial infections down the line. I mentioned this last year, but really before returning to full sport, you want to follow some of these protocols. So first, assess the personal fitness level of yourself or the athlete before returning. And if you feel like you have not been physically fit for the past 6 months to a year, do not go straight back into activity right away, because that will increase your risk for injury, not just with the infection, but muscle strains, ligamentous injuries, and other things, possible concussion, just like not having that reaction time as astute or acute as how you used to have it in the past. So really assess that personal fitness level and then progressively return to your activity to avoid sport injuries. There were condensed pre-seasons in the past. Right now, a lot of teams are working on that preseason engagement so that their athletes do not run the risk of these injuries going forward. And then make sure you maintain your immune system. Hopefully, a lot of this does not apply to your young kiddo athletes, but as far as, avoiding tobacco, avoiding alcohol, avoiding smoking and vaping, any of those things that can affect your lungs can really affect how you perform, along with making the COVID-19 infection more severe if you have any chronic lung issues from that. Make sure you properly hydrate, and then maintain a healthy weight. We have known that obesity increases the risks for severe COVID-19 infection. So really eating a healthy diet with your antioxidants, your fruits and veggies, and good fats, great proteins, increase that good carbohydrate for that energy level. Consult your local sports nutritionist. They're there to help really ramp up your hydration and diet so that you're optimal in your sport. And then get proper sleep. Sleeping 7 to 9 hours a night is very, very important. And then try to work on minimizing stress. So with meditation and therapy if needed, and seeking help with a mental health care provider if you do notice increased depression or anxiety symptoms. I really, really encourage everyone to follow these safe measures going forward, and hopefully we get back to a completely normal, regular sport season. That is a little bit ambitious for me to say. I know that COVID-19 is still around. We do have new protocols and new norms, but at least now with the vaccine being present, we can mostly go back to our normal day-to-day. And as long as we continue to play it safe, then we can go forward in this. If you have any questions, I'm happy to answer them. Again, my name is Dr. Tudan Kathy Nguyen, and I work at Physicians at Sugar Creek along with these teams. Please seek out care with your healthcare provider and a sports medicine physician if you have further questions and inquiries about what to do next for sports safety post-COVID-19 infection.